It's been 3 years since the onset of the COVID-19 pandemic, and shortly after its onset, people began reporting lingering symptoms of COVID long after they had recovered from the disease. They coined themselves the long haulers, with no sure fixes or explanations for their lingering symptoms.
It's a test of your character and who you are when you get sick. And it's not just you, but listen, you know the nurses and the doctors and all the people, they were helpless. They didn't know what to do.
Christoffer contracted COVID-19 in October of 2021.
All right, here we are.
He'd go on to spend 5 months in 5 different medical facilities, 44 of those days spent in a coma. According to the CDC, as of January 2023, 15% of adults in the U.S. reported having had long COVID symptoms at some point, and 6% reported still having current symptoms. Among people with long COVID, 79% report having limitations to their day-to-day activities, and 27% characterize the limitations as significant. The CDC defines long COVID as signs, symptoms, and conditions that continue to develop after initial COVID-19 infection. They say long COVID is not one condition, but represents potentially overlapping entities, likely with different biological causes and different sets of risk factors. So, for everyday Americans, what does that even look like?
Okay, so I spent my life living off my memory and knowing phone numbers and people and not having to make lists because I could go through it in my mind. And so maybe I was always a little different than others to begin with because I didn't need all that. I can't survive without it. In fact, I'll be writing an action list now. I'm like, what am I doing? I mean, literally. And so it's very, very short term. Mine is extremely short term.
With the loss of some of his cognitive abilities, Al knew he needed to look for different approaches towards recovery. Enter Kate Zamelka.
There are 2 approaches to health. One approach to health is we are going to medicate you and we're going to make sure that you are stable. And there's an approach that is in natural way of approaching. It's like, let's see what is the reason that you are feeling this way, or what's the core of why you are feeling this way or that way. And we can approach it with a more holistic approach, meaning looking at the whole body as a whole.
Across the healthcare industry, professionals report lacking a foundation for treatment of this new condition.
Yeah, I've been to the pulmonologist twice. He doesn't have any good news. He's a great guy, 45 years old. There's no reason to go see him anymore. There's nothing he can do.
So, with the guidance of Kate Zamelka, Al went on to try new methods for healing, landing his hand on something called a zytote scan.
I have done for him what's called Zydoscan. Zydoscan, and that is not related to Young Living, but it's just a computerized mouse and has a program that actually is scanning 197 points in male body with all the organs, including emotions, emotional or toxic stress. So your body actually gives answers what frequency the body needs right now.
The zytote scan is an electrodermal screening system. The machine measures the frequency of your body to determine what supplements it is missing to heal itself.
The oxygen radical absorption capacity shows you which food actually is going to be good and which one to take more.
The oxygen radical absorbance capacity, or ORAC scale, measures the level of antioxidants in various foods. The more ORAC units, the better the food is for you.
So if you are going to look, because there are scales. So like carrots, they are on that scale, they are 210. Oranges are 750, beets 840, raspberries 1220, strawberries 1540, blueberries 2400, and wolfberries are 25,300.
Combining the results of the zytote scan and the ORAC scale, Al now regularly incorporates antioxidant-rich foods into his diet, including his favorite supplement, Ninja, a red juice made from, you guessed it, wolfberries.
I think at the end of the day, I would say that's what we have to do, is provide a good support system for people. No different than those that got cancer and dementia and Parkinson's and Alzheimer's and say, let's come together and try to help you understand that there's nothing worse than not understanding what your problem is, because you'd like to be able to correct it. And I believe that 75% of your problem is know what your problem is, and the action, the 25% is to fix it. So I'm doing is all the action I can, knowing I got some benefit because I'm getting better.
Living life as a COVID long hauler can feel isolating and defeating. While significant strides still need to be made in the understanding of this disease, this world is still chock full of resources that may work for you as they did Al.